And what I wanted to do today is talk about environmental issues and problems that affect society today, affect many indigenous communities, but also, I want to talk and that we start thinking about how to leverage those problems for opportunities for better health. And I'll talk about the Stronghold study. I'll talk about the Stronghold water study. That is a project that we have ongoing in the Dakotas. And also I want to talk about how science and traditional indigenous knowledge can be really powerful if we work together. And this is, I think it's really great because, I am a public health scientist. I care about public health. And when you are a scientist in public health, you cannot do this alone. You very, very quickly realize that you need this collective competence and collective effort. And there are lots of different scientific disciplines that are working together. And like, I am an epidemiologist, I look into human health. I need to work with exposure scientists, with toxicologists. We need people who understand the genes and how the genes work, but we need to understand how behaviors work and the social sciences. Lyle mentioned we can stop smoking. Quitting smoking is very hard, as maybe some of you know. So understanding how social behavior and social communities can work better together is very important, and doing interventions, research is very important. But none of this could work. Science would fail miserably if scientists think they can work alone and that they are the owners of the real knowledge. That's totally wrong. And for us to be able to make an impact, we need to work with the trust, partnership from communities, and also thinking of this long-term sustainability. And I think that's why Stronghold is such a great example, is because it's been here for so long, based on trust, partnership, and this long-term sustainability. That's not always easy because the sustainability, we need funding, and that's one of the limitations, but that's why we all work so hard to make this going. So I wanted to start like that, and then say that actually I've come to realize about how important this collective competence is, also borrowing from traditional indigenous knowledge. And I want to show this picture here because I think they are very, very valuable and important indigenous principles that really motivate our work and make this happen. And for instance, I do a lot of work with water, and this concept that water is life, that the environment is life, that it's so ingrained in indigenous knowledge. It's sometimes in European-centric societies, this is lost. There is so much interest in business and making profit that the concepts of respecting the environment is lost. So that value of traditional knowledge that water is life is very important. And this concept of the 7th generation principle, that anything that we do to the environment and to our society is going to have consequences down the road for the generations coming. And so these are values that I respect, that I try to learn from them. And also the concept of collective leadership and the fact that we need to respect sovereignty, decision-making from the communities, from the indigenous communities. And that's the only way we can do this work. And I will come back to this idea of data ownership, because when you do science, there is a lot of data that is generated. And so understanding who owns the data and how we use the data in respectful manner is extremely important. And defending the sacred as defending our environment, it's very powerful, that message from the Dakota Access Pipeline protest, that I think it can give us, we can have a lot of energy that we can keep using for our work. So borrowing from that, I am going to show you this map, that it's a very interesting map with all the surface water, all the rivers in the US. And think for a second that there are no states, there are no boundaries, we just have the land and the water. And it's really powerful to see this map of the big rivers, you know, with the Missouri River, the Mississippi, all the other rivers. And of course, to understand that there are parts of the country, in the western part of the country, where the rivers are much smaller. The water is going to be much harder to access. And then when the surface water is more limited, or when we cannot use the big rivers effectively because the rivers are controlled in very political and geostrategical manners, so then groundwater is going to be a very, very important resource for communities. So groundwater is extremely important in all the western part of the country, but also in the plains and in many other parts. One of the problems with groundwater is that it's very clean from there are no microbes, so that from that sense it's generally really great. But the problem is that there are minerals that are very rich in the ground that leach out, and that makes those water, although they look very clean and nice to drink, they are contaminated with some toxic chemicals that you cannot see, unfortunately. And one of those toxic chemicals is arsenic. So arsenic, all these parts that are in red, orange, and yellow are parts of the country that tend to have, in the US, that tend to have high arsenic in that groundwater. And that's really true in Arizona. And I am so happy to see that Waylon is here, because I know that he's been walking for Hopi, for the Hopi Nation, and to bring safe water to the Hopi Nation. And I borrowed some pictures that Selena gave me, and I'll show them later. But you can also see that in the Dakotas area, in the Oglala Sioux tribe, and in the Spirit Lake tribe, there are also parts that look in orange. So those parts have been traditionally contaminated with arsenic in the water for a long time. But something that we didn't know is this bad for health? We knew from countries like Bangladesh, Chile, Taiwan, that arsenic in the water was toxic, but the levels in those countries were much higher than these 50 micrograms per liter, 10 micrograms per liter that you can see in this map. So we didn't know if this was a concern or not. So the Stronghold study was able to help us to provide, for the first time ever in the United States, for the first time ever in tribal communities, we could, for the first time, look if arsenic at these levels could be harmful or not. And the reason why this was important to look at this question is because in the year 2000, and actually in 2001, there was a change to the rules by the federal government. And they gave 5 years of time. In 2001, they said, by 2006, all the community water systems in the US, including tribal lands, need to be at 10 micrograms per liter. The federal rules said that, but the American Indian communities, many of them said, you know, we are worried because with which funding, how are we going to do this since we know we have arsenic in the water? And I have a picture here of Captain David Harvey. He's from the Indian Health Service. He's an engineer. And I met him in 2003, I met him, 2004. And he had done this study, putting together all the community water systems that were Indian owned, tribally owned, and look at what the percentage of them had arsenic higher than 10. And it was 16%. For the rest of the country, it was 4%. So this was a much bigger issue for tribally owned community water systems than non-tribally owned. But some people would say, oh, maybe the federal government is too strict, maybe we don't have to worry, maybe this is not a big issue. So the Stronghold study could help us see if this was true or not.
I have a question.
Yes, please.
So what on your map before, what is the white areas? Are those not tested, or is that just, okay?
So most of those is because they don't have enough data. That again,
a lot.
Yes, there is a lot. And this is because when you insufficient data, when USGS, the USGS is the US Geological Survey, they do groundwater sampling all around the country, but sometimes they don't have enough water samples. So that's something that we are really worried at. Yeah, you can see huge parts of the North and South Dakota that don't have enough data, including
Oklahoma as well.
And Oklahoma as well. So that's something that we want to help also, to be able to contribute in some of the more recent work. That's a goal of our, to be able to provide and help these parts of the country without data.
Thank you.
Yes. And so the Songhar study had been going on, as you know, since the late 80s. And it provided an opportunity for us to look at these questions. And think of this for a second. The study started in the late 80s. Water issues or arsenic, that was not part of the original questions. They wanted to look at risk factors for cardiovascular disease. Since the study, because arsenic could be a risk factor for cardiovascular disease, this allowed to go back to samples and to be able to answer this question, which for something that was really important for communities in general, to understand if this was a risk or not, if really should we allocate more funding for this problem or not. And as I mentioned earlier, trust and partnership and working together is really, really important. So I like this picture very much that we took in Eagle Butte, just in front of the office of the Songhar study in Eagle Butte. And it's amazing to be able to, and you can see here many people that you recognize, Mandy Freds and Marsha, of course, and others that you know, Lyle is just here. And it's great for us to meet once a year and to interact. This year we met in Arizona, in Phoenix, and we were able to meet with the community members from the Arizona side. That was wonderful. Just before the pandemic, thinking backward, it was a little bit risky that we had that meeting in person, but that was wonderful to meet. And I can't wait for us to meet again in person. And the question, as I mentioned, was, is arsenic in the water, but we measure it in the urine, because once we drink arsenic, arsenic is very dissolved. It's very easy to go through the water, and it goes into our body, to the blood, to the organs and tissues, and that's why it can be very toxic, and then it's eliminated through the urine. So if we look at arsenic in the urine, we can see if it's bad for the heart or not. We can connect it. And that's the beautiful thing of the Songhar studies, that we can actually answer that question. So we measured arsenic in the urine at the beginning of the Songhar study in all the centers between 1989 and 1981. Then we grouped the participants in 4 groups, those who had the lowest arsenic to those who had the highest. And then we control for other risk factors. For instance, we know very well that smoking is bad for cardiovascular disease, so we want to make sure that there is no confounding. So we did that. And this is all the study visits from the Songhar study. So we look at the first visit in 89, 91. And as you know, soon we'll be doing visit 7, which again, this is why sustainability and being able to keep things going, it's so important.